Let us also review the difference between osteokinematics and arthrokinematics. Osteokinematics, those are motions of the whole segment that occur in those three cardinal planes that we reviewed on the slide previous to this. So examples of osteokinematic motion, again, flexion towards the anterior, extension towards the posterior part of the body in that sagittal plane. Abduction, adduction, abduction away from midline, adduction towards midline, and internal and external rotation in that horizontal or transverse plane. Arthrokinematics, on the other hand, these are small motions that occur between the articular surfaces of the joints themselves. So these are motions that you can't visualize with the naked eye. You can see an osteokinematic motion, you can see flexion of the hip, but you can't see this roll, this glide, this spin, these arthrokinematics. So while you can't see them, they're just as important for healthy movement as the osteokinematic movement itself. Arthrokinematic motions include spin, roll, and glide. Spin is pure rotation. It's about the long axes, so there is no translation involved with spin. Roll includes rotation and translation. So roll is just like the tire of your car on the road. So it's going to be rotating, which is causing translation. Glide, that's translation only. So think about scooting a box along the floor. That's an example of glide. And all of these motions occur within the joints themselves. When you have a combination of roll and glide within the joint, so your femur moving on your tibia's example of a joint that has a combination of roll and glide, there's an important rule that we must follow. When you have a convex, so rounded surface, like the end of your femur, moving on a concave or dish-shaped joint, like the tibial plateau, the roll and the glide is going to be in opposite directions. So for knee extension and closed chain, the roll is going to be anterior, but that glide is going to be posterior. However, when we have a concave surface, like a dish-shaped surface like the tibial plateau, moving on a convex surface like the distal end of the femur, now the roll and glide are both going to be in that same direction. So for open chain knee extension, it's going to be a roll anterior and a glide anterior.